Today, we will discuss chronic kidney disease. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here, on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Chronic kidney disease, CKD, is a long-term condition where the kidneys don't work as well as they should. The kidneys are vital organs that filter waste and excess fluid from the blood, which is then excreted in urine. When they are damaged, waste can build up in the body, leading to various health problems. Key points about CKD. 1. Causes. The most common causes include diabetes and high blood pressure, but other factors like heart disease, obesity, and family history can also contribute. 2. Symptoms. In the early stages, there may be no noticeable symptoms. As the disease progresses, symptoms can include fatigue, swelling in the legs or ankles, changes in urination, more or less frequent, foamy urine indicating protein, shortness of breath, nausea or vomiting. 3. Diagnosis. To know if you have CKD, doctors usually perform blood tests to check kidney function, measuring creatinine levels, urine tests to look for abnormalities like protein or blood, imaging tests such as ultrasound to see if the kidneys are damaged. 4. Prevention and management. While CKD is often progressive, managing underlying conditions like diabetes and high blood pressure, maintaining a healthy diet, exercising, and avoiding smoking can help slow its progression. If you suspect you may have CKD or have risk factors, it's important to consult a healthcare professional for proper testing and advice. If someone has chronic kidney disease, CKD, here are some simple steps they can take. 1. See a doctor. Regular checkups with a healthcare provider are essential. 2. Follow treatment plans. Take any prescribed medications as directed. 3. Eat healthy. Focus on a balanced diet, low in salt, processed foods, and high in fruits and vegetables. 4. Stay hydrated. Drink enough water, but follow your doctor's advice on fluid intake. 5. Monitor blood pressure. Keep blood pressure in check, as high blood pressure can worsen CKD. 6. Control blood sugar. If diabetic, manage blood sugar levels carefully. 7. Exercise regularly. Aim for moderate physical activity, like walking, for at least 30 minutes most days. 8. Avoid smoking and alcohol. Quit smoking and limit alcohol intake. 9. Stay informed. Learn about CKD and its management to make informed choices. 10. Get support. Join a support group or talk to friends and family for emotional support. Always follow the guidance of healthcare professionals for the best care. In the hospital, if someone with chronic kidney disease, CKD, needs help, doctors and nurses may do the following. 1. Assess the condition. They check vital signs and do tests to see how the kidneys are functioning. 2. Fluid management. They may give or limit fluids to prevent swelling and manage blood pressure. 3. Medications. They provide medications to control blood pressure, lower potassium levels, or treat other related issues. 4. Dialysis. If the kidneys are not working well, they might start dialysis, a treatment that removes waste and extra fluid from the blood. 5. Nutrition support. They may offer guidance on a special diet to help manage kidney function. 6. Monitor. Continuous monitoring of blood tests and vital signs to track progress. 7. Education. Provide information on managing CKD after leaving the hospital. The goal is to stabilize the patient's condition and prevent further kidney damage. Here are some common medications often used to manage chronic kidney disease, CKD. 1. ACE inhibitors. Examples: lisinopril and enalapril. These help lower blood pressure and reduce protein in the urine. 2. ARBs, angiotensin II receptor blockers. Examples: losartan, valsartan. Similar to ACE inhibitors, they also help manage blood pressure and protect kidney function. Diuretics. Examples: furosemide, Lasix, hydrochlorothiazide. These help remove excess fluid from the body to reduce swelling and high blood pressure. 4. Phosphate binders. Examples: sevelamer, calcium acetate. These help control phosphate levels in the blood, which can rise when kidneys are not functioning well. 5. Erythropoiesis stimulating agents. Examples: apetin alpha epigen, darbepitin alpha, aranesp. These stimulate the production of red blood cells, which can be low in CKD patients. 6. Vitamin D supplements. Examples: calcitriol. These help manage calcium and phosphate levels and support bone health. Sodium bicarbonate, used to help maintain acid-base balance in the blood for patients with metabolic acidosis. Always consult a healthcare provider for specific medications tailored to individual needs and conditions. People at an increased risk of developing chronic kidney disease, CKD, include 1. Diabetics. Those with diabetes can have high blood sugar levels that damage the kidneys over time. 2. High blood pressure patients. People with consistently high blood pressure can harm their kidneys. 3. Older adults. As people age, the risk of kidney problems generally increases. 4. Family history. If someone has a family member with kidney disease, they may be more likely to develop it themselves. 5. Obesity. Being overweight can lead to diabetes and high blood pressure, both of which increase kidney risk. 6. Heart disease patients. Those with heart problems often have kidney issues as well. 7. Smokers. Smoking can damage blood vessels and reduce blood flow to the kidneys. 8. Frequent users of painkillers. Regular use of certain over-the-counter pain medications can harm the kidneys. 9. People with kidney stones or infections. A history of kidney stones or repeated kidney infections can increase risk. Taking care of these risk factors can help reduce the chances of developing CKD. Now you need to watch my video on bronchiolitis or have a look at metabolic acidosis.